Dr. Akano, you ready?
I'm ready.
Dr. Enya, welcome.
I may not be fully ready, but
You what?
oh, I'm s-
Are you
I'm
ready?
just trying to
Dr. Akano, you
uh,
ready?
1 minute or a few seconds, please. My
Okay.
computer is not allowing me to share my screen.
Okay. Um,
Let's see right now. Okay, I think it's
yeah,
working
we
now.
see your
Good evening, everyone.
slide.
You probably use
Okay,
links.
okay,
Yeah, we see your slide.
okay. Thank you. We can start.
Fantastic. Okay. Welcome. Welcome to Medical Mondays with Dr. O. I'm Tony Okwesami. I'm a primary care physician, family practitioner. I treat HIV and I treat addictions in Baltimore, Maryland, actually spanning across Maryland. And I'm excited to be here again tonight to come learn and maybe impart some knowledge from my end myself. I get excited every Monday night because there's always something to learn. But this month is Men's Health Month. And I didn't find out until, a couple of days ago. So, because our men are so special to us, and also because these same men usually don't seek medical attention until it's too late, this month is very important. So, we're going to focus on our men, hopefully for the rest of the month. And I want to thank Dr. Emmanuel Akano for stepping in to start us off today with the title, The Proactive Active, Taking Charge of Your Health. Basically, taking charge of our health generally. I'm sure we women will learn something from this too. Without much ado, I'm going to yield the floor to Dr. Akano to complete his intro and roll with it. Welcome, Dr. Akano. Thank you so much again.
Okay. Thank you so much, Dr. Person, and thank you for the invitation. Thank you, everyone, for being here today. So this is an important topic, and briefly, I will introduce myself and keep it simple. I'm a neurologist by training. I work at one of the federal government agencies right here in DC metro area. So we'll talk briefly the role, since this is mostly to kickstart Men's Health Month and may state supervision in many of the discussion. I believe my goal today is to be a little bit provocative in that, making us think about our health, men's health mostly. But this, I look at this when I consider this topic. I know we have women in this forum. So why is it important that we also listen to a discussion like this? And a notebook that I read several years back, two books actually. The person, Dr. Miles Monroe, wrote it like opposite. So I believe it's The Power and Purpose of Men. But there was a little bit of small note. He said, for men and for women who love them. And then he wrote the opposite book, which is The Purpose and Power of Women. They said for women and for men, women for men who loves them. Meaning in that this is a relevant discussion for either gender, because even as women or ladies, we have men in our lives, be it spouses, be it our own children, our brothers. And the statistics about men's health is alarming generally, and it's worse in the community of color. So, a brief, I've talked about my introduction that I'm currently employed by one of the federal agencies here in DC metro area, but the views I'm expressing are entirely mine and not related to that of my employer, and I will not be discussing anything of commercial nature, and there's no relevant disclosures for this talk. Now,
May I also add, before you continue, that we are
mm,
not establishing doctor-patient interaction on this forum. We will give you correct, cogent information, but we're not establishing care. Thank you.
thank you. So, when Dr. O asked me to talk about this, I was like, oh my God, I'm not a primary care doctor, and I'm not a urologist. Those are typically the people that get called upon to talk about men's health. But on a lighter note, I guess I get confused a lot for urologists, and I'm not talking about from group of people with accent like mine. Even in almost every hospital I've worked in the United States, I get these weird calls sometimes in the middle of the night. So like, oh my God, this patient is having immaterial. I mean, that's his blood in the urine. Or like, oh, I think it's a wrong page. I'm the brain and the nerve guy, not urologist. So on a lighter note, I think I do have a opposite problem of what this guy does was explaining in the picture. Middle of the night, pager goes up. They want to talk to neurology. He says, oh no, I'm urologist. So I have the opposite problem. So maybe I can talk a little bit about lean a little bit into my alter ego in quote as a physician of being a neurologist and talk a little bit about mental health. But let's jokes aside though, this is a topic that picked up interesting some years back, about 4 years ago, mostly as a leader of my local church men's group. And the concern then, the more I dig into it, and that was the first time too, I learned that the month of June is actually Men's Health Month, because we know typically men tend to ignore their health. And I believe the only role I have today is if I can be provocative enough to at least, number one, get every man on this forum take care of their health, and also the women in the lives of this of the men, whether they're here or not, to try to partner with the men in their lives to take care of their health. I believe everybody benefits, and the whole society generally benefit from such initiative. If we look at statistics, this is a table from some Harvard newsletter looking at comparing over the years, more than centuries of health data, looking at what the life expectancy is for men versus women. We know that because, advances in medical care generally, since 1900s, the life expectancy has increased. But even then, we see that usually there was about 2 year gap in terms of life expectancy between men and women. But it's interesting that as the medicine became more advanced, of course, people were living longer, but that gap got more pronounced. Even in the current data available from the CDC, it's still around a 5.4 year gap. And if we look at it very well, this gap is not just due to your biology, no. So, and again, different visuals, the same story. Say the death rate in men much higher over the years than women. Again, I'm looking at I'm originally from Nigeria, and so I usually, when I'm looking at data, I look at what is going on also over there. It's the same thing, male, female difference around 4 years. So, and as we see, because it was expanding as medical care became more and more advanced. So that's one proof that it's not just biology. It's partly because men, we don't like taking care of our own health. Again, like I said, I'm deliberately trying to be provocative to ensure that we look at that data, how alarming it is. So 5 years, men live less than 5 years less than women, and a lot of on preventable deaths occur more in men than women now. So why? That's the question we're asking ourselves, because if we know why, we may be able to at least attack the problem. So cardiovascular diseases, and sometimes really people just not taking care of themselves. And some of these, even though we are focusing on men's health, I believe, apart from talking that it is relevant for men in our lives, for the women, but also it's not, while some of these behaviors are commoner among men, it's not, to be honest, gender specific, especially among minorities and in the community of faith. We see that people do not want to really, people don't focus on their health. So unhealthy behavior, and sometimes too, not seeking medical attention when we need it. Less likely to adopt preventive health measures, because really that's where the key is. And since men are natural risk takers, sometimes if you look at the uninsured population, you find those more men. And sometimes the other, a little bit of nuances too, in for people working in dangerous occupational safety, but especially in an advanced country like the United States, there are a lot of safety guardrails put in place for all occupations. But if we look at the data, who are the people that are likely not to, to ignore those safety is still more likely to be men. So some of these and many more factors are responsible for the staggering difference in health outcomes that we see among men, and I think versus women. And I think that was what led to at least this initiative believe started. Was actually spearheaded by President Bill Clinton to ensure that we have 8 months dedicated to eight men's health, where we talk about, we remind men to take care of their health. This year, and I like what has been the target for this year, the focus this year has been talking about closing the empathy gap. The empathy gap being focused there is not talking about empathy for others, actually. It's really talking about caring for oneself, looking at it in that, look, we cannot chase occupation, money, or my family. Those are important. But realizing that when something happens, it affects the family. So the best way, if you love your children, if we love our spouses, the best gift we can give them is actually ensuring that we take care of ourselves to be there for them for as long as we can. Nobody lives here forever, but at least we want to do our best as human to ensure that we take care of our body. So we owe that to our family. So again, I said this year the focus has been on empathy and empowering men to take care of their health, and fostering open communication among men, among families, among men. We'll talk more a little bit about that. And as again, it's a recurring theme, what that we've discussed before, is really more of cardiovascular diseases are by far the commonest of cause, yeah, and cancer and injury. Okay, so, and I know in the past few weeks we talked about something that we just glossed over because I believe we've talked about it, and I do not know what Dr. may bring soon also as part of this series. You may talk more, but often if you look at people that will neglect their mental health, it's really men. So it's really, yeah, toughen it up. So I jokingly tell my wife that, look, once you get into those kind of territory, it's really more of toxic masculinity because there's no need dying in silence. But if we look at the culture, not just in this country where some of us came from too, it's like, man, just no, be a man. It's really more of like your phrases like man it up. So those are the kind of awareness that I believe this month is trying to create among men. Okay, we know. So usually when we talk about health, according to the WHO, we talked about complete physical, mental, and social well-being, not just merely an absence of diseases. So that means the physical health. We'll talk a little bit about that, mostly actually today. But the other part I started talking about also important, which is mental health, the emotional, social, and psychological well-being, and also meaningful relationship, social health, and connection with social health and spiritual health, because we are spiritual beings essentially. So, okay. Um, Now we talk a little bit about conditions, things we want to raise awareness among men. And this is more of a broad eye view of diseases that are relevant. Maybe if there are specific questions, we may answer. But like I said, this is more of like creating an awareness, really. So by far, the largest offenders are cardiovascular diseases, meaning heart disease. And I'm biased since I'm a neurologist by training, talking about stroke, but we know that some of these are usually from the trifecta of the risk factors that often tends to occur more frequently in African and African American population. So we look things like diabetes, hypertension, and high cholesterol. So, and even in the United States, about 1 in 3 Americans, eventually the cause of death is, whether directly or contributed cause of death, is heart disease, cardiovascular disease. But especially in blacks, it's higher, and is due to higher rate of hypertension. And then the other issues, socioeconomic factors come into play. And some of those include like um, higher rate of poverty and unemployment. But so the other part of it is really more of a psychosocial factor, which is really, um, I was asking a friend in church yesterday, and I was like, why? Why don't we take care of ourselves? Why do we not want to uh, seek help for our health? But anyways, I will I'm deliberately skimming through it may be a relevant slide later, but skim through the other 2 slides. But heart disease um, is really a common theme, really. And like we said, diabetes, hypertension, unhealthy diet. And as we adopt more of a sedentary lifestyle, so physical inactivity and sometimes, frankly, drug misuse are all contributory factor to this. Again, it's the same thing. I said I was biased for talking a little bit about stroke, but if you talk more about, it's the same theme of cardiovascular health, which is the same risk factors. that affect this. And I know originally I just modified this slide because of time originally, and that is me now pretending to be a urologist. When I prepared, this was the slide that I used to talk to our men's group sometimes in the past, where they were more interested in hearing about things that are peculiar to men, like BPH. And I know we have um, student physicians that can also chip in. So, uh, prostate, that's one thing that is peculiar to men. So, enlargement of prostate, we call it BPH. We do not know the cause, but we know it's extremely common as people grow older. And typically, we have symptoms like difficulty initiating urination, or frankly, sometimes difficulty urinating in advanced cases. And again, that is one thing that is peculiar to man. The same thing, that same organ can be affected by cancer. But like all cancers, we know that aging, the older we get, becomes more prevalent, becomes more common with age. So there are signs, symptoms related to this, but the good thing also is that I think is to encourage all of us to talk to our PCP, our primary care physician, about this. And the question, I like it when I go to my doctor, I was like, I want to be a patient. I ask question, don't treat me like I'm a physician. This and this, especially since I'm not in primary care. But what about this? So I think one of it is always asking questions. Do I need, especially as we reach the 50s, do I need to get tested for prostate uh, enlargement or cancer? There are multiple avenues of testing. Commonest, the blood test, which we call the PSA, or rectal examination. So, whether it is yearly screening or otherwise, I think we'll leave that to the conversation between your doctor and you, but definitely encouraging conversation. But again, now I'm switching the gears a little bit. So really talking about the screening, mostly the current recommendation do not support like yearly screening in 70s, but at least most people in their 50s to like the 69, you want to talk to your doctor about this topic. The other issue then common peculiar to men, since we are really talking about men, and I added one that's not peculiar to men, just because I've seen a lot of my friends saying, no, I will never have colonoscopy. But one of it is testicular cancer, thankfully extremely rare. But again, the approach we want to encourage is if anything is abnormal, seek help, talk out. Do not sit on any potential dangerous symptoms and say, it will go away. So the one I added in, and again, I'm just gloss is a broad eye view of topics I think will be often neglected among men, is colorectal cancer, because these are things that can be picked early by screening. There is the guideline typically is start screening around 45 now. It's been updated. So colonoscopy or stool testing, but again, partner with your PCP. But we do not want, because more and more we are seeing colorectal cancer more and more in younger people, especially in people like most of us, in Africans, in African American. But these are cancers that, if caught early, can, in fact, you can take steps to prevent full-blown, because most of the time, by the nature of colorectal cancer, people have precancerous cells that can be picked up by the tests that I mentioned. So I said I will just gloss over mental health, because I believe, even though I'm guilty, I didn't attend those, but I saw some of the invitation. that we focus on mental health previously in the past couple of weeks. But when the staggering statistics again, I'm just trying to like, I'm deliberately being provocative, but these are not manufactured numbers. These are actual, genuine statistics that suicide rate in men is about 3.5 compared to women. And most of the time, stressors and the traditional gender role can play a role. And more, again, when men are depressed, we are encouraged not to talk out. So man it up. So one of the things, the role, part of the encouragement in the team for this year, mental health, is the empathy, which is talk out, practice, talk out, encouraging open conversation and reducing the stigma associated with mental health. Of course, seeking professional help when needed, it's important. And generally, even before being in crisis mode, encouraging people to like practice healthy lifestyle, sleep hygiene, and some of the topics we've listened to on this forum, exercise, and having good emotional connection with friends and family. Now, again, some of these is mostly prevention we want to talk about. So, meaning preventive health. That's what that is what is more important in preventing some of these staggering outcomes. So number one, which is mostly healthy eating, and we can go into details as necessary, but most of us are familiar with eating balanced diet, fruits, vegetables, proteins, and the likes. So most importantly, I think what most of us struggle with is portion control, especially in the where I come from. You see like truckload of carbohydrates in our diet, but less and less of vegetables. There are multiple ways or guidelines that nutritionists advise on healthy eating, but one of the easiest way is talking about the so-called plate method, looking like, okay, like half of the plate filled with fruit and vegetables, healthy protein filling the half of the half, meaning a quarter, and the rest, like for some of us that eat a lot of, come from culture with carbohydrate rich diet, eat just a quarter. That is the recommended healthy diet. So the other thing we'll talk about is exercise, 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 meaning aerobic and anaerobic exercises. No, aerobic and exercise at least 5 times a week, at least 150, 3 to 5 times a week. And also stretching, not just, I think I'm guilty on that for a long time. It just, I enjoy running, jogging, but I do not want to do stretching and everything. There are a lot of studies that show that you need combination of both to stay healthy. The good thing about this is that it prevents cardiovascular diseases, but not just that. This again, I said I'm biased for for the brain, not just cardiovascular diseases, but also even for brain health. In my field, I deal with a lot of neurodegenerative diseases that we do not have any good treatment or care for, but almost all of them, we know there are strong data suggesting that exercise at least prevents or slows the development of the disease, and also uh, if anyone develops it, at least slows the progression of the diseases. So things like Alzheimer's and Parkinson's and the likes, those are well known uh, benefit of exercise apart from the sense of general well-being, better sleep, better quality of life, and I know the excuse we tend to have is, okay, I'm busy. But I think finding a time, again, the theme of self-care or empathy for self is part of taking care of oneself, and it's important to ensure healthy living. Okay, so again, just emphasizing this, meaning what have been discussed before. Combination of aerobic and stretching will be what is important. And it doesn't matter. We are in different state of health. So what I tell my patient is exercise as tolerated, but ensure you exercise. And as we make that an habit, we can always increase or improve the intensity as tolerated, but that it is important that we exercise. Or that thing again, what the essence or the theme of what I'm trying to talk about really is more of partnering with your doctor, meaning other things like immunization, uh, screening for cardiovascular diseases, diabetes, high cholesterol, and STI. So preventive health measures, we've punctuated all of these intermittently, as I was talking earlier on. Good sleep, avoiding drug misuse, be it alcohol or smoking, uh, maintaining annual health care visit to your primary care doctor. Uh, again, talking about what are the other things like avoiding risk, basic things like, again, not driving without seat belts, maintaining um, stress and good stress management, and asking for help early. This was something I think, again, I said this was a modified talk, quickly modified talk just for time. Again, but this was a pamphlet I think gave out just with brief recommendation of age by age screening, but it doesn't really matter. I think almost everyone with a good primary care physician, most of our primary care physician look and check all of this every year. The issue has always been not having one. And don't raise your hand if you don't have a piece of paper. It's just a joke. Don't do that. But I believe the essence of it is mostly after today's talk, I will pro I hope I've been able to provoke our men to at least, and the women to at least ensure we have a PCP. It is important just for general health sake, for all the health prevention and maintenance we talked about. And then also for the fact that depending on our insurance, if anytime, sometimes some insurance needs, even if you want to see a specialist, we mandate that the referral comes from our primary care physician. I've seen people that it is when there are challenges that they want to see a doctor, even sometimes PCP, and then, oh my God, it's taking forever for me to see a PCP or to see a specialist. But I'm sure most PCP can get us in if there is a need once we've established patient care relationship. The problem is usually waiting for crisis moment to try and reach out for help. And the other issue I've noticed is always sometimes, okay, I don't want to see a doctor because I'm uninsured. Depending on the state and our location, there are different ways of getting that. So private insurance through work and other, or sometimes governmental sponsored insurance, but usually there are always information to get insurance, and it varies. I don't want to stay on this point because it varies based on our location. Now, the second part that was being emphasized this year in terms of men's health is communication, communication, communication. Number one, fostering communication with your physician So encouraging each and every one of us to have a primary care doctor and also fostering communication with family. What do I mean by the second part? Again, that's where I started from. Winning is a concerted role, not just the men, number one, even the women in our lives, and ensuring that the younger men, the boys that will grow up to be men, are trained with good and healthy habits that can then become a lifelong habit. That's number one. Number two, especially in the communities of color, I my wife and I jokingly say we practice quote unquote secret society. What do I mean? We keep things a lot from each other. Sometimes things and health issues run in family. But I do not know whether sometimes because of religion or fear of stigma, we do not talk out. So sometimes without information is important when we seek health care, because some of these, if we are aware of certain illnesses that run in family, then we can at least start early to attack those and ensure that, well, we have good prevention in place, or at least good surveillance if it's something that's not that a preventive mechanism cannot be put in place. And then the other part is the family is always of good friends are always there to support. So that means it's there to support sometimes even when things are good, and also when in moment of health crisis. So it's encouraging all of us to lean on that support system and to stay engaged. I think I will pause here actually in terms of communication, and then see whether the contribution questions again. I wanted this to be brief, but mostly provocative to ensure that we look at we are aware of it. The essence of this month is really more about raising awareness. And I think some of those, once we sensitize people, developing a partnership with a good PCP can ensure that we get this in motion, encouraging us not to be afraid of seeing our doctor. It's not weakness to see your doctor. In fact, it is sign of strength. It is a sign that you care and you love your family and you want to be there for them for as long as possible in good health. Thank you.
Thank you so much. I appreciate you very, very much. So, if anyone has questions, please raise your hands or post it in the chat box and I'll read it out for you. But I just wanted to say that thank you for challenging our men to take good care of their health and to have a primary care physician who is the gatekeeper actually to our health. The primary care physicians are the ones that would do referrals if specialists are needed, as we have seen in that presentation. But prevention is always better than cure. It's always better to prevent. And thank you for raising the awareness for colonoscopy. That is something that I've seen that a lot of our people don't like to do. I don't understand why. You'll be sleeping, you don't feel it, you don't know it's happening, you're going to wake up and it's done. The there's a deal to it though, the prep, because you'll be given something to clean out your bowel and you will poop everything out overnight. But then after that, you go in and you don't feel anything. It's very important because it's the only test, actually, and Dr. Akano, tell me if I'm wrong, the only test that when they scoping through the colon, the urologist No, sorry, the
That's
gastroenterologist.
fantastic.
You are neurology and urologist
Yeah,
are in there
you have
getting to
been
my
doing well,
head.
please.
The GI doctor, the gastroenterologist, when they scope through from the rectum and they're going through, if they find any bumps, is what I'll call it. We call it polyps. They take it off right away, immediately. They don't come back. And then they send it to pathology. Pathology looks at it and then lets us know what is in there. Is it cancer forming? Is it just polyplastic? And that would dictate the next time that person will come for the next screening. If everything is clean and fine, it's every 10 years. But if it's a polyp that can cause something, they may tell you to come back in a year, 2 years, 3 years, 5 years. And that way, that person will not develop colon cancer. Ain't gonna happen. They'll catch it before it happens. And, they won't have to deal with that in their lives. The prostate screening, Dr. Kano, you mentioned that also. And it's true that we've been told to not routinely check it. But guess what? If you go to your primary care doctor for that yearly physical and you say, geez, that you want your prostate checked, they'll add it to your test. It's a blood test that they will add. I don't remember the last time I stuck my finger into a patient's rectum anymore, which I'm grateful for. We don't do that in the clinic setting routinely anymore unless it's necessary. So these tests are important. I wanted to say also the blood pressure. If you don't check it, you don't know. That thing is a silent killer, as we've talked about over and over on this platform. It's silent killer because you don't know. If you don't test it, you don't know. So when you go to the doctors, at least in the United States of America, they will check your blood pressure, even if you come for cough. In the primary care setting, we will still check your blood pressure and check the needful. So it's important that our men are not scared of going to the doctors. It's actually very important to do the preventive stuff, so that things are caught on time, even the blood work to check for blood sugars. Many people are walking around with what the labs call pre-diabetes, but I call it increased risk of diabetes because you can reverse it if the lab is checked and you know that you're at increased risk. Then with lifestyle changes, diet. Thank you for showing us, diet and talking to us about portion control. When you incorporate the good diet and exercise, guess what? Bingo, you can reverse the diabetes. Weight loss. You talked to us about weight, right?
A bit, and I'm sorry, it was because I was trying to cover like just a
Yes,
broader view,
yeah,
but
Tole
those are
Foundation.
mm-mm.
For the rest of the month. Thank you. Thank you for doing that, for laying the foundation, because you touched, you know, very important areas and you covered a whole wild field in men's health. But weight is a big one. Around the tummy, that weight around the tummy is so important that in medicine we have a name for it, truncal obesity, you know, that is different from the regular obesity because it causes a lot of health issues and health havocs. So feel free to raise your hand for questions, for input, or put it in the chat box. Dr. Alu said, thanks a lot for your insightful presentation. And Prince Adeboale Adeshida said, concise and straight to the point. Thank you. That
Thanks.
is true. That was a lot that we were fed in that small segment.
So, and just while we are waiting for questions, so just quick two interesting comments. Number one, the colonoscopy, I don't think can be overemphasized. Some of the things I put in there were just from my interactions or what I see. I'm using the men from my local church group. They are my friends over time, our main reason. And some of it, and some of my own friends outside this area where I live, was like not trying to, I do not want to do colonoscopy and things like that. But two interesting anecdotes scared me. I think I first, being like an apostle of colonoscopy, even though I'm no gastroenterologist, like two out of the people I recently forced to go and do colonoscopy, and then they found a polyp, and in two of them they were precancerous, and they were one of those people were just in that small, in the age group, meaning 45 to 50, that would not even have been captured in if we had followed the guidelines some years back. But again, these are the slow growing pre-cancerous cell that at least this is something that if taken care of can be completely prevented, like developing into full-blown cancer. That's number one. And just the other one is just an interesting joke or anecdote about trunk obesity. I remember one of my mentors, a molecular physician, when I told him I was going to get married in 2013, said, "How come you better watch yourself? What I've seen with a lot of our men, you get married and then you develop obesity, especially big belly. If I see you with that, I'm going to deal with you." So, but he was saying it in a kind of an interesting way. But again, what he was saying was that most of the time people just relax the older we get or more comfortable we become. But again, we need to look at it as really taking care of ourselves and preventing crisis in the future.
On point, on point. And, just to add quickly to that, colon cancer had become, more rampant, and especially in younger folks. That is why the standard now reduced the age that we start screening. It used to be that we start screening at age 50. Now it's 45. And, recently I have seen cancer in a 29-year-old going to 30, not even 30 yet. So maybe the standards will be reduced, but it's important to check it. And for people who are scared still for any reason, there's something called Cologuard. You can ask your doctor for Cologuard that uses DNA, and your stool, you're going to actually get the sample in your own home and mail it out. They'll send you the package. And if it's positive for cancer cells, then you must get colonoscopy. But you may get away from it for I don't know how long. If it's negative, then you don't have to worry. It means there's no cancerous cells or polyps in the colon. But please do one or the other. But we are rooting for the colonoscopy, for you to do colonoscopy, because it's the gold standard. Dr. Izugo, kindly unmute. Thank you.
Mhm. Just a
Your
second,
picture.
please. Yes.
Yeah, here you go.
Yeah, Dr. Akano, thank you so much for really and discussing preventive care with reference to men. Um, you know, you mentioned about stroke and ischemic, stroke and all that. Now, underlying all of this is hypertension, which, if you really look at it, you talk to two men, one of them have high blood pressure. But because it's silent, they don't pay attention to it. And most of those ischemic stroke is coming over 80% is more, vascular. And then dementia from that too, from those blood pressure uncontrolled. And the thing is that because it's silent, they don't pay attention to it. And we have good ways to not only monitor and manage it and prevent these conditions, but it's left like that. And then worst of all, many of them may have sleep apnea. They snore at night. The wife is aware of that. And they just said, she just snores. But that's a major problem because underlying that is now uncontrolled hypertension and not of that cardiac arrhythmia, cardiomyopathy, heart failure. It's a lot of things that we take for granted that can easily be managed and prevent a lot of these complications. One stroke in a family leader destroys the entire family. There may be leaders of churches, leaders of organizations, and one stroke, that's the end of the whole thing. But these things are easily managed if somebody is willing to work with another person to really monitor and manage them. Thanks again for bringing information again. Thanks.
Thank you so much. Thank you for
Sure.
creating that awareness. Thank you.
Mhm.
Dr. Jagbe says, address the common adage of, it is not my portion, regarding downplaying any potential diagnosis, particularly among people of faith.
You know what? I'm laughing. I'm sorry, I'm laughing. This has been a call, and please, I want people to chip in because this is something that I worry so much about. And I think about is something I hear from my own friends, from people that I'm pretty close to. Ah, because it's like sometimes you've had to take Bible studies on this and everything. And I'm trying to be a little bit guarded, but still very frank in our discussion. Uh, like since people will quote scriptures from me to counter that, to say it's not my portion, the Bible says so. Usually, too, I counter them back with the scriptures. Proverbs 22, verse 3 says, a prudent man, a wise man sees evil and eyes himself. The simpleton, depending on the translation you are reading, they go headlong and they are punished. So my people are destroyed for the lack of knowledge. So one of the things we need to tell ourselves, especially for people that are Christians, especially Pentecostal Christians, is like, look, it's okay, it's good to take care of yourself. Number one. Number two, and I'm sorry, good thing my pastor is not here. No, but my pastor is not like that. In fact, I think about 3 weeks ago, he took a big uh the, like a teaching on health. I was like, well, this was different. It's good people are hearing it not just from a doctor. You're not thinking I'm trying to like get you to like I have any commercial interest to talk about health, but hearing it directly from their pastor. So it's not like that, but I'm just joking that look, and I'm dependent, study the scripture very well. Sometimes bad things happen even to good people, even children of God. What he has promised us is that even in it, it will give us strength. But some of the strength, some of the resources he has supplied with to us is as usually medical knowledge. And then why do we want to like neglect that and do this? Like, okay, the other argument I hear, apart from God forbid, not my portion, I'm faith in it. I'm going to apply faith. Look, your faith is weak. I was like, maybe he's the wrong person. Like when I'm not in the clinic, maybe that's what is affecting me. I'm in the lab, chasing microscope and pursuing core basic science. So I'm probably sandwiched between two professions that like deal with hardcore evidence. So I was like, I'm not doubting this. But please, even in the Old Testament, in the scripture, if you are healed as a leper, the scripture says, go and show yourself to the priest. Because then there were no physicians. Those are the people that will certify the person. So if you are diagnosed with something, oh, you want to fit it, I have an opinion on that. But my own important recommendation is that, okay, find evidence. Faith is not denial, it's not hiding. Is an active thing. So if you think, but what I recommend as a physician generally is take care of yourself, use medication. And we can talk. This is something I can, again, I'm glossing over things. This is something I can talk on for hours because we see this. And I'm sorry, I was hoping maybe sometimes for time's sake, I don't go there, but it's an relevant conversation to have among our people, among ourselves. And sometimes one of my friends said it's probably because of socio-economic situation, but it's not true. I see people that are extremely comfortable and across both sides of the Atlantic, not trying to take care of themselves. And I'm happy that recently, at least, the places, religious houses are actually addressing this because sometimes it's more like, okay, it's a taboo, don't talk about it. And but like, I think I will pause. I'm sure there are a lot of people in this forum that probably have an opinion. It's because this was a question I asked somebody in church yesterday. But let me see what some of us think about this as well.
Well, I think most of us agree with you. So there's a question here that says, does frequency in sex reduce chances of prostate cancer?
Okay, now I will just this is the part I will deny being a urologist, but I practice what we call evidence-based medicine. So I know if you dig internet a lot, you will see things like that. I do not think that evidence is strong at best. So I do not. I think I've come across a couple of articles that suggest that, but again, that is not a strong evidence. When we look at evidence, we grade evidence. So I think by far what plays a role in development of prostate cancer is genetics and age if the person grows old enough. And that is why sometimes one of the things I buried in the presentation is about having a conversation about things that runs in the family. We know prostate cancer is so common, especially commoner in Africans and African American. But I think the way any physician would triage someone that says, okay, I have people in my family that develop prostate cancer at 50 is different from someone that says, okay, I have somebody in my family that developed prostate cancer late 80s or 90s. So I believe more of doing things that are like evidence-based, which is like, okay, family history and screening is more important. Of course, part of normal, we've been encouraging psychosocial well-being is okay, at least within the confines of good relationship, married relationship. That's encouraged. If so far your spouse is as frequent, and I'm joking now, as frequent as both of you agree on. So far, what we don't encourage medically is dangerous, things that predisposes to STI, really. So, but yes, I know there are, to summarize, I know there are articles out there on the internet that suggests that, but it's not a strong evidence. But yeah, it's part of normal well-being in confines of good marital relationship. Keep going at it. But I do not, it shouldn't be, it's not, the excuse is not strictly to prevent prostate cancer. There are different other ways. Again, generally, for most cancers anyways, things that we talk about in terms of healthy living generally are still the most important way to at least reduce the chances, even if one has inherited a gene for those conditions.
Thank you. Thank you. So, Auntie Tower asks, which of the two interventions is better for prostate cancer treatment, the cyber knife or normal traditional surgical intervention? So, Auntie Tower, that question is, above this forum because we're not establishing doctor-patient interaction, and we don't know who is on the platform going through needing to make a decision like this. Decisions like this will be personalized, and it will depend on the individual. We don't want people to walk away and think that this procedure is better than the other when situations are different and would demand that one will be or may be better than the other. I hope I answered your question. So Prince Adeboale Adeshida says, What is the role of dietary intake in the prevention of prostate cancer? And what Nigerian foods can slow it down or shoot it up?
Okay. And I think
I don't
Dr.
think
O
you
is
want.
about to answer, and I probably no, because what I do not think, again, I try to restrict myself to evidence-based medicine. And at least the last time I checked the literature on this coming from Nigeria, with the caveat that it's not something unlike my specialty that I follow like almost every week. There is nothing to say there's evidence for one food against another. So what we are encouraging in this from, it's more of healthy eating. There's no specific recommendation that eat this, do not eat that. So that's what I will leave it as, but I will allow Dr. O to chip in.
That is 100% on point. There's no research that has shown that any foods increase or decrease the incidence of or the incidence of prevention, same thing, of cancer, of prostate cancer. So there are no Nigerian foods that will slow it down or shoot it up. Prevention, though, in screening is important. And again, here in the US, it is no more standard. But if you ask your primary care doctor, they would check the blood test, the PSA, the prostate specific antigen. They will check that. So there are lots of things on the internet. Be careful of Dr. Google. Mm. It can steer people in places. Oh, my brother, Anthony Richard Williams, welcome, sir, says, while portion control is important, however, are the portions recommended in the European diet applicable directly to the African diet?
So my answer to this will be nuanced. Again, I want people, the physician on the front to chip in. Number one, in fact, I think we need it more than the Europeans. And I will share a personal story. There was a time for some weeks, I put on a continuous glucose monitor. And I was seeing what some of my the way I used to eat in terms of truckload of either gari or pando yam or other food that African diet, the amount, what it was doing on my blood sugar. I was like, oh my goodness. Okay. Nobody told me. And then I literally went back to the plate method that is directly European, like most of those research are truly from European people of European descent. And I see that things can kind of like flatline, stable, not all those what we call postprandial surges after I ate. So I think we need that portion control more. The problem, I think, really, and I believe somebody just raised that question but below the like two questions below this particular question we're addressing, is that we are used to a particular pattern. And that pattern, honestly, at least from where I came from in Southwest Nigeria, is really surplus of carbohydrates that you supplement it with protein. I believe, and I've spoken to at least a couple of nutritionists that are of Nigerian descent that practice here in the United States. In fact, this reminds me, I need to follow up with one of them who promised me she was going to send me like modified plate method for African diets. But either way, but even most of them agree that now the way we eat typically now is still not healthy. And the good thing is that those research might have been originally from people of European descent, but most of them are by far evidence-based guidelines. And we are not, I'm not advocating for abandoning our food. I like our food, sorry. But what I'm advocating for is like at least balancing it out, being a little bit adventurous with at least the healthy option It may not be good for your taste buds initially. I used to, during residency training in Illinois, I used to have an attendant when we have a patient that we are discharging after stroke, was a stroke neurologist. Was like, he jokingly tells the people, my recommendation for you in terms of diet is anything that you think is not good for your taste buds. Playing it over time, I think you'll find it good because his own essence of joke is really more like most of those things are not as palatable, but there are decent ways we can cook those to be palatable. And I think I'm veering off the main question, which is the portion control by and far, by and large, at least from talking to some uh, nutritionists of Nigerian descent, at least who can relate to the culture and they've been trained there. By and large, it may be modified, but it's really still applicable to our best, what we call healthy diet, really. Though it may be a difficult proposition, which over time we adjust. And also I did the like couple of weeks experiment on myself, and I saw the kind of damage I was doing to my body. Nobody told me to kind of back off eventually in terms of the amount of the portion I was taking in my own food.
The portion of the African food or European food? Which one spiked your blood sugar?
The African is the swallow for people that are familiar with what I mean.
Swallow.
Yeah, so that was the one I wasn't controlling and I just cut it
Okay.
drastically.
When you said it swallow, which ones in particular spiked your blood sugar?
No, the worst offender would be Gary.
Gary,
Then Pando Yam
cassava.
was cassava was also the Pando Yam, but not as bad because I studied this. And I think by far the one at least that was unique to me. I'm not taking this as medical recommendation, please. Was the one that was the least problematic for me was the plantain.
The plantain fufu, plantain amala.
Yes, that was the least. The regular amala too wasn't bad, but the best by far was that. But the worst offender was the Gary. Portion for portion it was unreal. I run away from it unless when I'm in a hurry. I want to quickly fix something to eat since then. But again, everybody's metabolism is unique. But I was curious and I had access to CGM. So like, okay, let's do this.
Nice. I think we should do another round of that one and just see with someone else. I'll talk to you about that offline. And then we can bring back, more news about our food, Europeans, and comparing them directly and what portion is what. So, Dr. Enya said, talk to us about the role of vitamin D and prostate health. And
Okay,
thank
to
you
be
for
honest,
bringing up that vitamin D issue. Thank you.
okay. Now, I will be careful about this, to be honest, because no, not out of trying to dodge question. This is something. Vitamin D, number one, vitamin D deficiency is common a lot, not across population in the United States now because we are staying more indoors. We are not getting good source of vitamin D. Of course, we know that if your skin color is black, the melanin prevents vitamin D from actually for the body from absorbing vitamin D in sunlight. So we are more predisposed. We are staying more indoors. In fact, I most people that look like me that get to their vitamin B check is either borderline low or low. You see people encouraging supplementation. Why I said I will be guarded and other physicians on the forum can chip in was that is one thing I know for neurology. For example, my field, vitamin D deficiency have been implicated in either in worsening or associated, not 100% relationship with a number of neurological conditions, including multiple sclerosis and the likes. However, so we just say correct, optimize vitamin D. However, one thing, to be honest, that I never really follow is the literature on prostate cancer and vitamin D. So I do not know It's something I can check and we can get back to you. But I do not know for certain whether it's been implicated or not with development of prostate cancer.
Actually, it is. There's research that have shown, I believe, that um, vitamin D deficiency actually can cause or is implicated in aggressive prostate cancer. The ones because prostate cancer is normally slow growing. But these days we've been seeing prostate cancer that has been, just aggressive, just doing, what is not normal. And vitamin D has been implicated in that. It's also Johns Hopkins, I think Mayo. I'm not 100% sure about Mayo. I've done a lot of research on vitamin D, and the researches are still going on. I've not checked in a bit, but for what I know, vitamin D deficiency can cause high blood pressure, multiple sclerosis, as you mentioned, osteoporosis, low back pain, and constipation. It's been linked to not, the primary thing, but linked to colon cancer, dementia, and depression. And so the list still goes on. And then, the prostate cancer one, aggressive prostate cancer, I saw that also. It's important that we check our vitamin D, especially when we have this color, black. Like Dr. Kano said, the melanin we have that protects our skin from developing skin cancers. It protects us from developing skin cancers as opposed to our Caucasian counterparts. Also shields us from absorbing that vitamin D from the sun. And our Caucasian counterparts, we encourage to use sunscreen. Even Black people are encouraged us to use sunscreen when you're going to be in the sun. I see a lot of vitamin D deficiency in my practice. At least over 90% of people have deficiency. And Dr. Kano, believe this, even people from Africa, I think because of the, melanin, and also because back home now too, people are not spending, enough time in that early morning sun. And so the deficiency stretches across. Thank you for bringing that up. It's very
Yeah.
important to check and to replace it. It's simple. Just, one pill a day um, can change all of that narrative. So, Nkechi, oh, good evening. How are you? Says, what is the life expectancy of a person with colon cancer? Oh, I don't think we can answer that.
Yeah.
Do you know what the life expectancy is?
Because no, because it's a variation, and I work with folks a lot with NCI. Is a factor of like what stage the cancer was caught, and these days, especially in the United States, it's also a function of the molecular characteristics of the cancer, meaning what kind of gene is expressed, because there are newer medications that target all of those. So it's on an individual basis based on what stage and what they were seeing in pathology. So it's a difficult question to answer, though we still know it's a very aggressive form of cancer, but thankfully can be picked early if through all the options we talked about, the Cologuard and the colonoscopy that we mentioned earlier. And thank you for that question, though, for the prostate cancer. Like when Dr. was talking, uh, I did a quick PubMed search again. That's one part of literature I don't follow. Uh, and it's a lot, there's a lot and lot of papers looking and exploring prostate cancer and vitamin D. Is well linked vitamin D deficiency and prostate cancer, like Dr. O said.
Well, thank you. Thank you. Um, when we were young, we were only given chicken legs. Now that we can afford to eat the whole chicken, they said it is cholesterol. When are we
Mm.
ever going to chop life? is the question.
Okay. Okay.
Okay.
Okay.
So
You
what's
can
your
go
take
ahead.
on that?
No, so my thought about that is I think it depends. We need to look at this in a different way, in that, and some of these may veer to philosophical, in that, number one, what is the meaning and purpose of life? I like there's a poem that I memorized. Some I think most of us know that poem actually, because we quote the last stanza of that poem, which says it's a Psalms of Life by Longfellow. I know we quote that says we say it's lives of great men remind us we can make footprints in the sands of time. But I think it started by anyways, let's not go into poetry. But the part that started that I'm emphasizing is I think is the third stanza in that poem. It say, not enjoyment, not suffering is the life's end. It's not, that's not the purpose. If you look at it very well, because my issue is that there are many ways to enjoy life. Somebody very dear to my heart has asked me that question before. One anyway, this is the recorded, so this is a recorded speech. So before I get myself into problems, like one of the people that would be like my own grandmother's, like just leave it that way. And I was like, look, you can enjoy life. We love you. There are many ways you can enjoy life. We can buy you nice clothes, we can buy you nice things of life that won't kill your body slowly and make you suffer and die a painful death. Then that ceases to be enjoyment. I don't think she likes my answer that day, but I passed my message across. Because again, there are multiple ways you can enjoy life. That, and in fact, especially from the background some of us came from, that some of like we can eat healthy food. What I see as enjoyment as I grow older and like at least more comfortable than situation where I grew up in was like, okay, I will eat healthy diet, balanced diet, and I can eat variety, whether that I like. Even if I want to eat expensive once in a while, I want to splurge. Okay, you can splurge on healthy food, healthy seafood once in a while. But in terms of the quantity of something that will kill my body, because then when it brings uh, high blood pressure and the complications of diabetes and the complication, especially against, we know that genetics plays some role in some of these, but we also know that our lifestyle influence, even when we are genetically at risk, our lifestyle influence when we get any of the, if and when we get any of this. So I say, okay, the enjoyment is being able to eat varieties, being able to eat things sourced from good places. But in terms of enjoyment or eating something in terms of big quantity, that kill myself slowly. No. And that was what I told my quote unquote grandmother at that time. And she wasn't happy with me, but I was like, but I think she took it. And thankfully, the person is still alive and she's really in good old age. So,
Praise God. Praise God. So chicken legs, whole chicken does not cause high cholesterol. However,
that's true.
the skin of the chicken is the problem. What you want to eat is the flesh. The skin of the chicken, between the skin and between the skin to the flesh, is laden with fat. Next time you get a chicken, look at it. When you boil it, you will see that that yellow fat is in between the skin and the flesh. So you can take that out even before you cook it. Take that out because that would increase your cholesterol. And then when you fry it, oh my gosh, it's crispy and tasty, but high in cholesterol. So is the skin. The skin is the issue, not the chicken. And I agree with Dr. Akano. There are many ways to enjoy life. I agree totally with that. But it's the skin of the chicken that is the culprit in cholesterol, not the chicken. I hope that is helpful.
Thank you for that point. I forgot to, I like that. Sorry.
So, Nkechi asked again, can colon cancer be completely cured?
So again, I think I would defer to the answer before, but again, number one is individualized, and I'm seeing a lot of one field I can hardly keep up with is the oncology field. Thankfully, there are a lot of advances in that field. So, and I've seen in my work, I've seen some remarkable results that it is, I mean, if one mentioned it when I was in medical school, you think the person is crazy. That's like you tell the patient, outright impossibility. So there are good things to think about in terms of oncology field as a field. However, again, because some of the therapy they're doing either immunotherapy or molecular-based therapy, they're all based on individual characteristics that they test. So if that has conversation has to be between an oncologist and the patient. However, what we do know is that, and that's part of why I'm kind of almost reiterating or overemphasizing the need for screening. When we catch the polyps in the polyp stage, those are the ones that develop, the precancerous polyps are the ones that develop into colon cancer. Through screening, if we catch the polyp, the precancerous polyp early, you literally have a cure because that's a cancer prevented. And depending on what they are seeing under the microscope, when they test the polyps, the gastroenterologist and the PCP will make recommendation on the frequency of screening. I think that stage is what is the most important in terms of preventing colon cancer. But the cure for somebody that either through, and as Dr. mentioned earlier on, we are seeing more and more of cancer at early age, colon cancer at early age, that if somebody is in that situation, individualized care in the hands of a competent oncologist is usually what can determine the prognosis in terms of treatment.
Absolutely. But I want to add that absolutely colon cancer can be cured depending on the stage. When the cancer is already formed, depending on the stage, and it can be. It's a process. Then, you know, when they have ostomy bags and all of that. It's a process, but it's individualized. It depends on the stage that the cancer is caught. So, Prince Adeboale, kindly unmute because we want to learn this. He said, as a biochemist, he has been privileged to research food in prostate cancer, that is, and have seen dietary intake affect the growth and reduction of prostate cancer. Kindly unmute. This is a very important one to talk about. Prince Adeboale. I'm looking for it. There you go. Thank you so much. Kindly educate us a bit more on that one because you wrote a lot here. I think telling us would be better.
Okay, good morning, everyone.
Good
I
morning.
am enjoying this topic because prostate cancer has been taking a lot of people, especially in the Nigerian space. And I think we should also look into our diet. That was why I asked the question that does dietary intake affect the growth or reduction of prostate cancer? There are so many researches going on in the biochemistry field, especially in Africa, that is pointing markers on several types of food. And the doctor also mentioned some things about swallow, heavy foods, which also affects. And I also believe that animal fats, like Dr. O just said that the chicken has also contributed. So I think there's a strong point pointing to what we eat affecting the growth or reduction in prostate cancer. It's just unfortunate that when it has happened, that's when people see it. But I think if we can start adjusting to our diets, I think we can so much prevent it. I sent a picture here showing two human beings. One is taking um, soda, burger, and different stuffs, and the other one is on fruits and lean meats. You know, we are what we eat, and this is, I think, this is very important in this discussion. We should begin to look at what we eat as a preventive measure in prostate cancer. Thank you. I don't want to be too scientific tonight, but I don't know the audience that I'm talking to, but I feel that we should look into what we eat. It's very, very important. Our oils is also important that we check it. Can affect our health regarding prostate cancer. Thank you.
Thank you so much. You were right on point. Our audience is diverse. So your language is perfect because we have people from different backgrounds here. And thank you for this picture. I wish I know how to put it on the screen, but you can see sodas, they have high fructose corn syrup. You have chips there, burgers, hamburgers, the killers, chips is another one. I'm sure it will be somewhere on that body. And look at the weight, causes obesity and causes problems. But look at the other guy. Look at the muscle with, the good eating. Oh, fantastic. Oh my gosh. Thank you, thank you, thank you, thank you. Thank you for posting this. Look at the guy on the left-hand side. Prince, thank you so much. This is amazingly beautiful. The veggies, fruits, lean meats, and look at the muscle, look at the strength. That's a very healthy person. This guy on the right can hardly breathe. Look at the neck mass, the width, the neck width. Look at it. So what we eat is very important. I just did not know about the correlation to prostate cancer, but thank you so much. But cancer is cancer, really. It just depends on where it is, right? Anyways, what we eat is very important. And yeah, Dr. Izugu, kindly unmute while I'm searching my search here.
Yeah, thank you so much for this image.
Yes.
It underscores again, we for heart disease prevention and training in our nonprofit, we really, do food pantry and really trying to get to understand that the food you have you grow in your, the plants you grow at home is much, much better for you, not only for your health and disease prevention, than anything else you take your kid out to go to this fried place because it's an English food, or you're eating, instead of having water with you, then you have soda or Coke, and you think it's making you a big man or a big woman. Those are very unhealthy. Just look at that guy who is big. These are sometimes we take, some people take their children out to go eat this thing and say that they're treating them well. You are not. You are really creating a taste bud for them for what is not good for them. You really need to give them the food that's on the right side for that guy who's eating basic plants, basic foods that your body can metabolize and be in good health. Because your health and what you put in your mouth determines how you're going to be in 5 years' time. Okay? So please, thank you for this image.
Thank you. The image is so
Thank you.
impactful. Have you seen children that are like this? And their arms are like that, spread out like that, because they cannot put it real close to themselves because of the weight. We really need to watch what we eat, and we need to be careful with what we feed our children so we can set them up for success in life. Thank you so much, Prince. I cannot thank you enough for this picture. So, and Dr. Ajagbe said we should remember that vitamin D3 It's more bioavailable in combination with vitamin K2. Well, this was deep. Thank you so much, Dr. Akapo. I hope our men have been challenged, and I hope we all got something out of this. I definitely got a lot out of this. But before I turn back to Dr. Akapo to give us his closing remarks, I wanted to share a message that I was sent to the Medical Mondays family. We had the Solution Prayer app launch on Saturday, and it was beautiful. It was very well attended. It was amazing. I encourage every one of us to go to Google Play and or Apple Store to go download the Solution Prayer app. It is loaded. Please share it with your church members, share it with your friends, and let it remind you 6 times a day to just stop for a few seconds to pray. Or you can use it for your devotion, for lots of things. So, Mr. Sheun Oyemade, the CEO and the founder, the maker of this app, wrote to you, Medical Mondays family. He said, "Dear Dr. O and the Medical Monday team, I want to extend my heartfelt gratitude to you for your incredible support during the launch of the Solution Prayer app. Your presence and encouragement truly added depth and warmth to the occasion. Dr. O, your kindness, heart for people, and unwavering belief in this vision have meant the world to me. From the very beginning, you have supported this project not just as a friend, but as a partner in purpose. Your sincerity and compassion continue to inspire. To the Medical Monday team, thank you for being part of this journey. Your work within the medical and wellness community aligns so beautifully with our mission of holistic healing through prayer, faith, and community. It's an honor to be connected to such passionate and purpose driven professionals. As we continue growing the Solution Prayer app to reach more lives, I look forward to future collaborations and to seeing how our efforts can continue to bless and support the health and spiritual growth of individuals everywhere. With heartfelt thanks, Evangelist Sheun Oyemade, founder and CEO of Solution Prayer app. So, Medical Mondays family, thank you for always being there. Thank you. And oh, there's a question, Dr. Akano, for your closing remarks. What we eat influences health outcomes in instances of illness. That is true. So it's a comment, not a question. Thank you so much for your contribution. You're very right. You're right on the money. What we put in our body is important. It's been suggested that we eat our foods as medicine and not medicine as food. So, Dr. Akano, over to you to give us your closing remarks.
So I know, thank you. I know we've touched a lot of things, and I've actually learned from all of us and from our comments. So, and then because we've touched so many things, I think the only closing remark I will put out is question to us: what will you do differently? It starts with baby steps, and it will differ from individuals. For some of us, it may be okay. It's time to get a primary care doctor. It's time to establish care. For other people, it may be okay. I have a PCP, but I've not been exercising, or like my diet I've been poor. I'm going to improve on that. But I want us to start with at least one thing that we'll do differently. And thankfully, it's the beginning of the week, and it's also the beginning of the month. If the week passes by that we don't achieve that, let not the month pass by where we don't put something in motion. That's how to be proactive. And with that, we can actually be able to like do a lot of things to help our family, our community, and at large. And I believe no matter where in faith we belong, that's the will of God for our lives. Thank you.
Thank you. Thank you so much. So, baby steps, correct? Baby steps until we attain our goals. Thank you. So, till we meet again next week, please be safe.
Thank you.
God bless you all.